Your nerves can affect everything from your touch to your balance, and when they are not working properly, it can cause some serious problems. And this morning, Dr. Joe DiDuro and Dr. Bruce Whitbeck are here to talk about neuropathy. Good morning to both of you.
Good morning. Good morning.
I'm very interested to learn about this. What is neuropathy?
Well, neuropathy is problems with the nerves. Peripheral neuropathy affects the nerves in the extremities, like the toes or the feet. Anything that affects the nerves is going to give you problems that you might not even know. First times when the nerve is damaged, you lose function.
Okay, we're seeing an image here.
Well, this is showing the nerves and how they work. They relate to each other by passing signals along. In the foot, in the lower extremities, this can lead to serious problems when those nerves, you see how they're functioning well. A lot of times people with diabetes will have trouble with the high amount of sugar, will make those nerves not work and damage them, and the nerves will actually slow down.
Well, you mentioned that people with diabetes suffer with this type of, it has an acronym for me.
PNS, peripheral neuropathy syndrome.
PNS. So, in addition to people with diabetes, who else suffers with this PNS problem?
Usually we see them over 50. It can be diabetes, but it can also be spinal stenosis if they've had a surgery. A lot of times we're seeing patients that have had chemotherapy for cancer treatment, and they're left with residual problems that they really didn't want.
Right. I can't imagine that anybody would. Now, how do you know if, in fact, what you have or what you're experiencing is officially peripheral neuropathy syndrome?
Well, what happens is when the nerve is damaged, you lose function, so it's a sensory loss. And most people don't pick that up. Like, I can't tell I'm going deaf, but I can tell you're going deaf.
Okay.
Because you'll have to turn up things. And it's the same thing. People will lose sensation, but they don't usually run to the doctor and say, it doesn't hurt right here. One of the things that we do is we'll see patients actually when they'll have pain or tingling or burning or numbness or symptoms of these damaged nerves.
Can you tell me what's unique about the way you treat patients that might be different from another place?
Well, it all starts with the evaluation. The evaluation is state-of-the-art. It has been put together. It then goes into a treatment protocol where we've taken lots of different segments that have been shown to be effective, and then we're using low-level laser along with other protocols and other treatments as the patients progress. So it's very unique. It's very different. No one else is offering this.
So that right there is a low-level laser?
Yes.
And it's treating internally. Interesting.
We actually are treating the nerves versus it's a drugless, non-invasive, non-surgical therapy where most patients, if they have any, some patients are told there's nothing we can do for you.
Right.
And this is an option that really works. It changes people's lives. And we're actually treating the problem. We're not giving them medication or something that's going to just treat their brain. If the problem is in the periphery, like a carpal tunnel syndrome, or a sciatica, tingling in the feet, that's where you want to treat the problem. And this offers us a unique mode of taking care of these people.
I understand that you have a special offer for people that are looking at you going, yes, that is me. You're going to provide a free evaluation and something else for them. Tell me about that.
We have an informational pamphlet and DVD. If anybody has questions about this and wants some more details, they can contact our offices, and we will perform our highly unique 24-point evaluation for the nerves, both the large and the small fibers, at any of the offices at the Neuropathy Treatment Centers of America.
Thank you so much for coming in and talking about. I know this is going to be welcome news for a lot of people who suffer from this. For more information on how you can speak directly with Dr. Joe DiDuro, he is in Casa Grande. The address specifically is 400 West 2nd Street, and the phone number to give him a call is 520-421-3084. And then to get in touch with Dr. Bruce Whitbeck, you can go to 4910 East Greenway Road, of course in Scottsdale on the other side of town, or you can give a call to 602-867-4800, or you can call either number to receive that free informational DVD and pamphlet, and you can find more information about both doctors on their website. We also want to mention that Dr. Joe DiDuro